Live from San Diego, this is the Fox 5 Morning News at 7.
Will a Trump administration change your insurance? With more now, Craig Gusson, health insurance expert, joining us this morning. And Craig, don't worry, we will not ask you to do any of those snow angels.
Thank you so much.
Yeah,
Appreciate it.
You got it. Okay, let's talk about this. The big question now, will the Affordable Care Act change enough when Trump takes office? Now we're going kind of back and forth. Explain what's going to happen.
Well, probably nothing's going to happen in the next 12 to 18 months because, you know, it took the Obama administration 4 years to make Obamacare, the ACA, come into place. So what we're guessing is there's going to be recommendations made. There may be things passed. But there's two issues that we're going to deal with. One is we're California. We have a state-run plan. So whatever the federal government does won't affect California unless they pass a law that says that, state plans have to, work the same way the federal plans do, or if they stop funding subsidy money for people who are getting a subsidy. So what I'm expecting is some things will be changed, but then whatever new health plans are going to come out, the insurance commissioner in California is going to have to approve it. So we're looking at probably 12 to 18 months before something really happens. So anybody who thinks they can just stop paying health insurance and, President-elect Trump is going to do something, that's not going to happen for at least a year.
It's not going to happen. It's certainly, like you said, at least for another year, year and a half. Okay, talk to us about the last day to sign up for Covered California, because we're still doing that, to sign up for 2017.
You need to sign up by December 15th.
Okay.
If you do that, you'll be effective January 1st. If you sign up on December 16th, you're going to have to wait until February 1st. And that's going to be the last day to sign up. Actually, I take that back. If you sign up after January 15th, it would go into effect March 1st. But that would be the last time to sign up in 2017.
Okay, what about subsidies? What are we looking out for here?
Subsidies, big key, because if you're getting a subsidy today, you need to check your income.
Right.
If your income is less than what you put down on your Covered California application, you may be getting money back. But in most cases, you may have worked more this year, making more money, so your subsidy should actually be a little bit less, which means your refund, if you get one, is going to be less, or you're going to get a nice letter from the IRS saying you owe some money. So be very careful about that. It's something we always recommend to our clients. Check what your income is on your pay stub, every 3 to 6 months, just to make sure you're close to what you expect.
Right.
Because unfortunately, under the health care reform law today, which I hope is changed in this aspect, your subsidy in 2017 is based on your income in 2017, and nobody in America knows what their income is going to be next year.
Exactly.
So I'm hoping we can change that to a point where maybe your next year's subsidy is based on last year's income, which makes more sense and would be easier for people to know exactly what their subsidy is going to be.
Okay, one thing a lot of people are concerned about is the rate increases.
Yes.
We've talked a lot about it on the show, 20%, 25%, whatever it might be. Some companies will increase in January, so what should you do? Do you ask questions now about those increases, or you just deal with it when they come?
Well, what we're doing is our clients are sitting down with us, or at least calling us right now and saying, what can we do?
Yeah.
Blue Cross and Blue Shield both had rate increases over 20%. Blue Shield was the only company that used the Scripps network of doctors and hospitals. Health Net has come out with a plan that uses most of the Scripps doctors and hospitals. So by going to a Health Net plan, you're probably going to not have a big rate increase, where Blue Shield is going to expect a major rate increase, at least 20%. Blue Cross uses mostly Sharp doctors, UCSD. We're recommending to our clients that if your doctors are in the Sharp network, go directly to Sharp. They have a Sharp health plan that you can buy that will definitely save you a lot of money. Maybe it's time to consider changing doctors.
Sure.
If you're okay with that, there's a lot of options out there that you can do. Work with your agent. It costs nothing to you to work with your health insurance agent, and they will walk you through the process. Like doctors and hospitals, we get paid by the insurance companies.
The whole process can be intimidating. It's very confusing sometimes. So we thank you for coming and trying to clear it all up. Craig Gusson, we thank you.
My pleasure.
All right, still ahead here on the Fox 5.